Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Abnormal uterine bleeding can be a number of different changes in a woman's period. Most women have periods that occur between 3 to 5 weeks between periods. Any bleeding that's occurring more than every 3 weeks or intervals that are lasting more than 5 weeks is abnormal. Periods can also be abnormal if they're very heavy. A woman's change from her baseline amount of bleeding is really the best judge of heavier periods.
What causes it?
There's a number of different things that can cause abnormal bleeding. Problems in a woman's hormones can cause their periods to be irregular. Sometimes there's structural changes on the inside of a uterus, overgrowth called polyps, or a type of benign tumor called fibroids, which can cause abnormal bleeding.
When should a woman call her doctor?
I think any woman who's bothered by a change in her periods can talk to their gynecologist about what sort of evaluation should be done and what kind of treatments can help her. And like I said, any bleeding after menopause needs to be investigated.
So a woman should really listen to her body if there are changes.
It's one of my little soapbox points is I like women to know that any bleeding after menopause is not normal, even if it's just a small amount. I think a lot of women who are approaching menopause in their late 40s or early 50s, they don't get their period as often as they used to, and this can be normal. It can be part of just regular approaching menopause symptoms. We call it perimenopause. And that can be normal, but again, it's best to talk to your doctor about what's going on.